crucial for healthy growth. And World War II aircraft crashes in the Hudson River in New York. Good evening, this is GBC 24 and GTV. It's time for News Hour. My name is Yoko Kwakutre.
I am Shirley Anand.
UNICEF estimates that poor nutrition in the first 1,000 days of a child's life can lead to stunted growth, which is irreversible and can reduce academic performance. And this can affect the country's development progress. In view of this, the Ghana Journalists Association and Nestle Ghana have trained some selected journalists to use their reportage to help address malnutrition in the country.
Data from UNICEF indicate that nearly half of all deaths in children under 5 are attributable to undernutrition. This translates into the unnecessary loss of about 3 million young lives every year. According to the report, undernutrition puts children at a greater risk of dying from common infection, increases the frequency and severity of such infections, and contributes to delayed recovery. In terms of overall progress towards the Millennium Development Goals, Sub-Saharan Africa is far behind all other regions and farthest from reaching a 50% reduction in stunting prevalence since 1990. Meanwhile, the number of overweight children worldwide, which is another aspect of malnutrition, is rapidly rising. This requires the collective engagement of society, government, private sector and the media. In 2014, AU leaders at a meeting in Malabo renewed their 2003 commitment to allocate at least 10% of their national budget to agriculture. This is expected to promote food security in Africa by reducing malnutrition and poverty. Knowing the power the media in information dissemination, Nestle Ghana collaborated with the Ghana Journalists Association to educate the public on the need for good nutrition for child development.
We need a health and nutrition-oriented journalism to help bring key national and global health issues to the fore. Reporting on maternal and infant nutrition issues requires a collective engagement with society, government, and private sector in identifying the key topics, stories, testimonies, and experiences that can create more awareness and impacts about this important subject.
We once again appeal to journalists to specialize in very important areas like nutrition, health journalism. So as the media space expands, we expect journalists to also specialize in tandem with the expansion of the media space.
A representative of the Ministry of Health, Mr. Bernard Nyakuchei, tasked journalists to work hard to ensure that the public is well educated on good nutrition.
There is no gainsaying in opening our radios and hearing the sensational news on air, but deep down, the remotest part of Ghana, some mother somewhere cannot have access to health care, yet we cannot report on that. Somewhere, deep inside the remotest part of Ghana, a child is not getting even 1 square meal to eat. As a nation, the time has come for us to prioritize what is of value to us.
As part of the training on nutrition, Nestle Ghana organized a cooking competition for the group of journalists from TV, radio, the print and online media, as well as bloggers. They prepared boiled yam and palava sauce, banku and tilapia, rice and stew, garnishing vegetables and fruit dessert. The TV group emerged winners, followed by those from the online and print media.